I love that DC Pink Divas reaches out, educates, and empowers women. So first of all, that they understand why they need to have it done. And then we help them navigate the system. I had to hook up. If we didn't have organizations like DC Pink Divas, a lot of women in my ward would just die. They would die. And I can't let that happen. This is where I grew up. These are my peeps. These are my people. These are my patients.
Breast cancer is now the most common cancer. 30 years of increased awareness, early diagnosis, and treatment access contributed to a 40% decline in breast cancer deaths. Yet Black women are still more than 40% more likely to die of breast cancer, the highest breast cancer death rates across ethnic and racial groups. Today, Black versus white breast cancer mortality gaps persist, and Black metastatic breast cancer patients still have a poor prognosis. In 2020, delays and avoidance contributed to an 85% breast cancer screening drop. Therapy interruptions and abandonment increased, while clinical trial enrollment decreased. MBC patients experience increased isolation, risk of severe illness, and death from COVID-19. In response to this compounded crisis, digital engagement has been adapted and accelerated across the oncology care continuum.
The DC Pink Divas Intervening Virtually to Advance Saving Lives, Divas, is a 3-part evidence-based program that aims to educate, empower, and mobilize Black-led breast health advocates to improve outcomes by targeting patients, providers, and policymakers through digital and in-person interventions. Divas collaborates to combat the digital infodemic and end disparities in care by engaging patients with and educating providers and policymakers on breast cancer risk, breast cancer disparities, and social determinants of health through grassroots and digital campaigns to drive breast health equity, reaching advocates where they live, work, play, and pray. Over a decade, nearly 70 advocates participated in a 1-year patient navigator-led 6 to 8-part curriculum, including clinical trials, genetic testing, patient empowerment, digital outreach, drawing from best practices of the precaution adoption process model, health behavior model, and the social ecological model as displayed on the right. Methods include gathering quantitative and qualitative data from pre- and post-assessments, navigator observations, and one-on-one phone interviews. As you can see with the row chart displayed on the right, through the 2011 in-person pilot and 2019 virtual cohort, Divas has continued to show increases in key patient outcomes like 85% and 90% respectively for provider communication confidence, demonstrating that the best practice engagement utilized by Divas in a culturally attuned manner is effective in an in-person and virtual setting.
Recommendations informed by a decade of Divas collaborations includes acknowledging that behavioral health interventions alone will not close the gaps from COVID-19, advancements in public policy and health system changes that continue to prioritize access to telemedicine, online psychosocial support programs, virtual patient navigation, access to oral medications, vaccines, and screenings for high-risk deferred care and vulnerable populations must be made.
A decade advancing behavioral health interventions in breast cancer has allowed for DC Pink Divas to support sustainable programming for collaborators across the nation. Here are the recommendations as shared by a couple of our collaborators.
Give the vaccines and to have less risk because of the vaccine that we are providing that. Reaching out to our patients. These are the things that we're going to have to do to keep our patients safe, and then also to begin to work towards getting back to those normal health and safety prevention issues. That some of the appointments for our patients need to be worked into their health and wellness schedules. So we've moved to doing appointments on the weekend and giving them the opportunity to come in and have those prevention studies so that we can catch up in those gaps of patients that were unable to get it while we were seeing less patients during the height of COVID.
We began doing digital programming over 10 years ago, and they're realizing that patients are the expert, and they have to come to us to ensure that what they're building, even with the research question, are they asking the right question? And so the beauty in that is that if you can partner with patients throughout the process of asking the right research questions, building the right kind of studies, getting diverse patients to be a part of those studies, getting their input on ways to eliminate barriers around literacy, socioeconomic access, trial access, trauma about being Black and not trusting physicians. And then using what you've learned to build solutions, that's how it's going to work better after COVID.
Finally, we must invest in what worked well by promoting and normalizing telehealth medicine and digital engagement to foster trust between patients and the healthcare system to improve health outcomes. By using coordinated patient-centered interventions and public health data-driven digital campaigns, we can continue to meet patients where they are, capitalizing on the positive and mitigating the negative consequences of COVID-19 on cancer care.
Divas is excited to enter the next decade, further accelerating digital collaboration with patients, physicians, providers, and policymakers to advance breast health equity.